This is lesson 26 on licensure of individuals. We're going to be covering book pages 133 through 145. So we're going to start with pharmacist licensure and licensure by examination. You can see the requirements are listed for you on page 133 to get your license by examination. The primary requirement is you pass both the NAPLEX and the MPJE, but there's some additional requirements there about graduating from an accredited school. If you graduated from a foreign pharmacy school, there's some additional requirements you can see there related to the TOEFL exam and the foreign pharmacy graduate equivalency exam. One thing to realize if you're a foreign graduate, you do have to have 500 hours of licensed supervised work as a foreign graduate intern with a Florida preceptor. You can have the additional hours you need for internship from another state or some other location, but at least 500 of those hours have to be once you're registered with the state of Florida as a foreign graduate intern. The total requirement on the number of hours is 2,080 hours of internship, both for any type of applicant to get a licensure by examination. Turning over to page 134, as I mentioned, you got to pass both the NAPLEX and the MPJE with a score of 75 or better. I think the rule incorrectly says 75%, but it's actually 75 on a scaled score. And actually NABP doesn't even give you your actual score anymore. They only tell you whether you passed or you failed, and sometimes they even mess that up, as you may have heard more recently. They didn't actually get that right with some of the graduates last year. One thing to realize is, in letter C on the top of page 134, that once you apply for a licensure, you have to meet all the requirements within 1 year of turning in your application. So you don't want to wait too long if you haven't completed all the requirements for licensure once you apply. And also your examination scores are only valid for 3 years. So if you pass the NAPLEX and then you have a difficulty with the MPJE or you don't have your internship hours, try to get it done within 3 years, otherwise you may have to retake the NAPLEX or some other part of the licensure process. Licensure by endorsement is the second way to get your license in Florida. Endorsement is Florida's terminology for reciprocity. Most states call this getting your license by reciprocity, but in Florida it's called endorsement. Here you've already taken and passed the NAPLEX, perhaps in another state. And if you've been practicing two of the preceding 5 years as a pharmacist in another state, you can apply for licensure by endorsement, and then you'd only have to pass the MPJE exam. And some other, if you haven't been practicing for 2 of the past 5 years, if you're a recent graduate from out of state and you're in a residency program, or as long as you've taken your internship requirements within the past 2 years, you also qualify for licensure by endorsement. So once you have your license is going to be renewed every 2 years, and it's always on September 30th of odd number years. So I'll be renewing my license in Florida on September 30th of 2023, along with every other pharmacist. They don't space it out from different people different times of year. Everybody renews at the same time. And in order to renew, what do you have to do? Well, of course, you have to pay the renewal fee and answer some questions. But the most important thing is you have to meet the continuing education requirements. So let's talk about what those requirements are next. So the basic requirements for continuing education for your pharmacist license in Florida is that you complete 30 hours of continuing education every 2 years. But remember, this is September 30th to September 30th. It's not a calendar year. Within that 30 hours, you also must complete 2 hours of approved, Florida board approved medication error CE, and then 2 hours on validation of controlled substances, which we covered when we did the controlled substance rules. I know when I renew my license, I always got to make sure I go back and get those two extra courses, because my general CE that I get for my other license doesn't cover those Florida specific requirements. Another Florida specific requirement is that 10 hours of those 30 hours must be live programs or computer-based interactive computer-based applications or video teleconferences. They just want to make sure you're just not doing everything. In the old days, we used to read magazine articles, and you could get CE by that by filling out a questionnaire and stuff like that. So just remember, 10 hours have to be what we call live CE, but can now also be with the internet, can be internet-based interactive computer applications. If you are administering vaccinations, and we'll cover the requirements for vaccinations later, but you'll see there, but an additional 3 hours of your 30 hours must be related to vaccines and immunizations. There are some additional requirements when you do your first renewal of your license. And the first one is a 1-hour course in HIV and AIDS. This was put into place a long time ago when HIV/AIDS was fairly new, I'd say, but it's still in the law. But it's only a one-time requirement on your first renewal. The other thing that I didn't realize this, but I got this off the Board of Pharmacy's website, because it's not actually in the rule. But it's good to know when you get your license, because you could fall into this. When you renew your license for the first time, if it's 12 months or longer until the next renewal, because remember it's every other year in Florida, you may have to complete half of the CE requirements. And you'll see that on the bottom of page 135. You would have to do the 15 hours of CE with that first renewal, and 5 hours of that have to be live. So it's exactly half of the regular 2-year requirement. But you still have to do the 2 hours of medication errors and 2 hours of controlled substances in that case. If your renewal comes up, and let's say you get renewed sometime in 2023, and come September, it's time to renew for a next 2-year cycle, you're less than 12 months, you don't have to have those 15 hours. However, in addition to the 1 hour of HIV/AIDS, you do need to complete that 2-hour of medication error and 2-hour controlled substance course. So a little bit tricky there on the top of page 136, but I think it's very important for those of you that are going to get licensed, what you have to do in that very first initial renewal. Okay. Let's talk about ways you can obtain continuing education. The primary way that most pharmacists get their continuing education is through an ACPE accredited course. The nice thing about ACPE accredited continuing education courses is every state will recognize those courses. So if you're licensed in multiple states, you take a course, you'll get credit for both of those states. Like myself, I'm licensed both in Texas and Florida. When I go to an ACPE course, I know that those continuing education hours are going to count for both Texas and Florida. ACPE does something funny, and you'll see this in the study tip on page 136, is everyone speaks of continuing education courses in terms of number of hours. How many hours do you need? How many hours is the course? But ACPE uses something called a continuing education unit, or CEU, and it's actually 1/10 of the hour. So a 1 hour course would be 0.1 CEUs. So don't let them trick you on a question about are they asking about hours or are they asking about CEUs? I think ACP is the only one who does it that way, but when you see a 3-hour course, it's only going to be 0.3 CEUs. Some additional ways outside of the ACPE approved programs to get continuing education in Florida. On the bottom of 136, you can get up to 5 hours of continuing education if you sit through an entire Board of Pharmacy meeting where they're going over disciplinary hearings, where you watch pharmacists and pharmacy technicians come before the board for some type of violation, and they're going to have their license disciplined, either revoked, suspended, fined, or whatever. So if you can attend one of these meetings, you can get up to 5 hours for sitting through one of those meetings. I always found it interesting and funny that they said if you're at that board meeting because you're being disciplined, then you can't get the 5 hours. You can only get that if you're going to watch other people get disciplined, but that was kind of interesting. Excuse me. On the top of page 137, you can also get CE up to 5 hours for doing volunteer work for indigent or underserved populations But you only get 1 hour of credit for every 2 hours of volunteer work, which is kind of interesting. You would have to document that somehow so that you could prove that you actually did this volunteer work. When I saw this, I was excited because I did some volunteer work out of the country, and I was going to see if I could use that. But then I realized when you read the rule carefully, it's got to be for work done within the state. So I didn't do mine in Florida. I did mine out of the country. So there's some other ways you can get CE. You can read there if you're doing postgraduate work, or you're going to be an expert witness, or if you're the presenter of a CE program. All those count are additional ways to get your continuing education. Some additional CE details that I want to go over on page 137. There's something called the Tripartite Continuing Education Committee that Florida has. So this is a committee that approves any Florida specific continuing education program. And we're going to be talking about a lot of these as we go through the rest of the course. It's called a tripartite committee. Tripartite means, three parts, and the three parts are equal representation from the Board of Pharmacy, then somebody from the colleges or schools of pharmacy in the state, and also from practicing pharmacists, usually someone from one of the pharmacy associations. The tripartite committee can approve CE from someone who's not an ACPE provider. And this is used for the Florida specific continuing education, such as the ones listed on the bottom of page 137. There's the initial consultant pharmacist certification, and we'll talk about that a little bit later. The recertification for consultant pharmacists, nuclear pharmacists recertifications, medication error one that everyone has to take that 2-hour course, even the HIV/AIDS program. There's one if you're going to be ordering laboratory tests, which we'll talk about later. And there's a laws and rules course that you may have to take as part of a disciplinary process. All these types of CEs have to be approved by the tripartite committee. If you turn the page over to 138, the other ones are the quality related events continuing education, and the validation of controlled substance prescriptions, which is also mandated that everyone take those. And I put a study tip there on 138 because there's a slight difference here. All those Florida specific continuing education programs have to be approved by the tripartite committee. However, the two newest certifications which we have in Florida, which are for pharmacist test and treat and collaborative practice, the statute for those when they were approved said that those certification and programs have to be approved by the Board of Pharmacy in consultation with the Board of Medicine and Board of Osteopathic Medicine. So because that requires a joint effort of several boards, at least in consultation, I don't think that one's been delegated to the tripartite committee for approval. That's actually got to be approved by the Board of Pharmacy. There are very specific requirements for all these programs in rules 26.60. I don't think they're going to get too much detail on that, but the tripartite committee simply goes through the standards in that rule, and if you meet those standards, you can get your continuing education approved by the committee. I do want to mention two of those programs that are approved by the tripartite committee, and those are the ones that often come about as a result of disciplinary actions by the Board of Pharmacy. The course on laws and rules has to be at least 12 hours long, and it has a very specific list of topics that have to be covered. But 12 hours for the laws and rules course, and the quality related events course has to be at least 8 hours in length. And where we see these are, as I said, in disciplinary actions. Oftentimes when a pharmacist is being disciplined or a technician, they in addition to any fine or suspension or anything like that, they will also make the individual take a laws and rules course because they might have been in violation because they were not familiar with the laws and rules. So I see that a lot in disciplinary cases. The quality related event one is often mandated by the Board of Pharmacy for someone to take when there's been a dispensing error, a medication error, some type of quality error with failure to catch a drug interaction or something like that. That will sometimes be mandated by the Board of Pharmacy for someone to take. So you don't have to take these courses unless you're mandated to do so. So it's important to track your continuing education. Florida has its own tracking system that the Florida Department of Health requires you to use. It's not just for pharmacists, but for all healthcare practitioners, and it's called CE Broker. Any of the Florida approved continuing education providers will report automatically to CE Broker. ACPE courses will not necessarily be reported to CE Broker, however, because there is a national tracking system that everyone else uses through NABP called the CPE Monitor. So you will need to get accounts for both of these types of systems. The CPE Monitor one, if you go to a meeting, a national pharmacy meeting like APHA meeting or ASHP mid-year meeting, and you get CE, those are all ACPE approved programs that will get reported to the CPE Monitor, and you'll have a CPE Monitor number that NABP will give you. What I usually have to do when it comes time to renew my license is I have to download my transcript from CPE Monitor that has all my ACPE approved CE, and then upload that to the CE Broker one, so the Florida Department of Health can see that I've met all my continuing education requirements. All right, so Florida has on page 139 a consultant pharmacist license. And I've given you the statute and the rules where this is covered. And the consultant pharmacist license is pretty unique to Florida, I think, because it's an additional license you can get as a pharmacist. You're not required to get this, but all institutional pharmacies in Florida, we'll cover that in the next lesson, must have at least one consultant pharmacist of record. So if you're working in a hospital, nursing home type setting, that type of practice, you may want to become a consultant pharmacist. To become a consultant pharmacist, you must pass and take a 20-hour continuing education course, a consultant pharmacist certification course. Again, it's approved by the tripartite committee. And it's got a very specific list of topics that must be in that course. I listed some of them for you on 2C on page 139, but if you look at the complete rule, you see all the topics that have to be covered in a particular course. And it even covers things like nuclear pharmacy, which doesn't sound like it's something a consultant pharmacist would need to know about, but that is one of the requirements in that curriculum. So I've added a section here about collaborative practice by consultant pharmacists. So I want to make clear that this is not the general collaborative practice law that was passed in 2020, the more recent one that any pharmacist can do. This is something that was passed earlier on, but it was restricted only to consultant pharmacists. And what it said was it allowed consultant pharmacists working under a collaborative practice agreement to perform medication therapy management for patients in a healthcare institution. So this is one type of expanded pharmacy practice, but I didn't include it in that section because it's specific to consultant pharmacists. And I explained that in the note there on number 3 on page 139 that the law change in 2020 now allows any certified pharmacist to do collaborative practice, but this is the old law that was still in the book that was restricted just to consultant pharmacists. And you can see on page 140 what this allowed consultant pharmacists to do, including ordering laboratory tests, modifying or discontinuing therapy as agreed upon in the protocol from the physician, and even administer drugs in a healthcare institution. In order to do the laboratory tests under this authority, consultant pharmacists had to do a 3-hour laboratory initial continuing education course, and then a 1-hour course on the bottom of page 140 every year to renew the authority to order and evaluate laboratory tests. So there may be consultant pharmacists who are still operating under this provision in the law and haven't done the new collaborative practice that any pharmacist can do. And there may be questions on this one versus the new one. So that's why you got to be very careful when you approach these questions on the Florida MPJE. The other thing with a consultant pharmacist license on number 4 on page 140 is when you renew the license, you have to have 24 additional hours of consultant pharmacist continuing education. This is what's often called consultant pharmacist recertification. So it takes quite a few hours of continuing education to renew your consultant pharmacist license. Remember, this is an additional license, so you'd have to have your 30 hours of continuing education for your pharmacist license and an additional 24 hours of approved consultant pharmacist continuing education to maintain the consultant pharmacist license. Okay, let's turn to 141 and talk about registration of pharmacy interns. To be a pharmacy intern, you must be enrolled in a school of pharmacy to be in a pharmacy internship program, or you must have just graduated and not yet have your license in the state. You could still be an intern until you get your pharmacist license. One thing to note is that if you are an intern and you leave pharmacy school, you have 30 days after termination of enrollment to notify the Board of Pharmacy so they know you're no longer in school and no longer a pharmacy intern. The other thing to note here in number 5 on page 141 is if you are a foreign pharmacy graduate intern, they can only be supervised on a 1-to-1 ratio by a preceptor. If you're a U.S. graduate, there can be more than one intern working under one preceptor, but foreign pharmacy graduate interns must be supervised at a ratio of 1-to-1. You can see the requirements to be a preceptor for interns on page 141. You have to have a current license. You can't have any discipline against your license, and so forth. So the total number of hours that interns need to get licensed as a pharmacist in Florida is 2,080. You can see that on the bottom of page 141. There's some special rules that you can only get no more than 50 hours a week while you're in school, and 60 hours a week after graduation. So they don't want you working too many hours a week for your internship hours to count. Okay, on 142, we'll look at pharmacy technician registration. The requirements for that are listed at the top of the page for you. The main thing here is the pharmacy technicians must have gone through a board-approved pharmacy technician training program. And you can even go to the Board of Pharmacy's website and look up which training programs have been approved by the board. Many of the big chain pharmacies have had their programs approved. Some of the federal armed services programs have been approved. But I want to make sure you understand, and this is in the study tip on page 142, having certification from an organization like the Pharmacy Technician Certification Board in and of itself is not an approved training program. That just certifies you, but it does not qualify you for licensure in Florida. You must still go through an approved pharmacy technician training program. And just like pharmacists have to do continuing education, so do pharmacy technicians. You can see the requirements for that on the bottom of page 142, 20 hours of CE during a 2-year renewal cycle. They must also do the 2 hours on medication errors, and 4 of the 20 hours must be live or video or computer interactive programs, as opposed to the 10 hours that pharmacists have to do for that. Okay, a couple other additional licensure rules that I want to cover. If you don't renew your license becomes delinquent, and you can't practice while your license is delinquent. And while your license is delinquent, you can go back to active status by paying a fee and showing your proof of continuing education. However, if your license is delinquent and you go through another 2-year renewal cycle and you still haven't renewed, your license now becomes null and void, and you would have to apply for a new license. If you go look up my license in Florida, you will find my first license was null and void because I didn't renew it there for a while because I moved out of Florida a long time ago, and I decided to go back and get my license again. So I have a new. When I did, I got a new license number, and you can that can happen. You can also go into inactive status. Inactive status allows you to renew your license as long as you're not practicing. You still have to pay the fee when you go inactive, but if you don't have the continuing education hours and you're not practicing, it might be an option for you. But remember, you can't practice while your license is inactive. There's also provision for a retired license on page 144, you can see, as well as some exemptions that exist for members of the armed services and their spouses, which is a really nice thing they do for people that are serving our country. And these people move around a lot, so that helps them a lot to maintain their license, and you can read through those particular sections. I do want to point out on the top of page 145, there's a section on proof of licensure. There's a board rule on this. You really need to have a copy of your license in your primary place of employment. It doesn't have to be displayed where the public can see it, but upon request by someone from the Florida Department of Health, maybe an inspection or something like that, they may have to see a copy of your license. So even though you don't have to put your licenses on the wall where the public can see it, you do have to wear an identification badge, and the board is real big about this. They want to make sure everyone in a pharmacy is properly identified so the public is not confused as to who is a pharmacist, who is an intern, and who is a pharmacy technician. So that's noted for you on letter number 6C on the top of page 145. All right, and with that, we have finished this lesson, and we'll pick up again and talk about pharmacy permits on page 145 in the next lesson.